Hello, everyone. Today, my group and I would like to talk to you about helping patients manage their medications. So let me know if this sounds familiar to you clinicians. You ask your patients about their medications, only to learn that they don't know what medications they're taking. And adding to the problem, you learn that the patient doesn't know how and when to take their medications, nor do they even know why they're taking them in the first place. And this appointment was only scheduled for a brief follow-up. And so you tell the patient that you'll go over their medications during the next visit. But that next appointment could be weeks or even months away, and in the meantime, your patient could be lost and confused trying to manage their medications and ultimately can cause more health issues arising. And so, building on the idea from our upperclassmen, we helped with creating medication passports that were customized to each patient based on their preferred type of medium, whether it be electronic or even handwritten. And this was all for the goal to help patients better adhere to their medication regimen. Now let's discuss the impact this could have on patient care.
So after seeing this problem and coming up with this idea, we dove into the literature. And from the literature, we see that the national data indicates that there are more than 1/3 of US adults that have a limited health literacy, when this overall contributes to poor health outcomes and affects patient safety and healthcare access and quality. And so there's recommendation to use universal health literacy precautions to provide understandable and accessible information to all patients, regardless of literacy or education levels. The study done by Cavareros, it discussed using a computerized intervention to improve health literacy. And this study kind of acknowledged that the ability to offer individualized patient counseling based on information gathered during their intervention and allowed for precision counseling, defined as the approach to disease treatment and prevention that takes into account social factors, environmental stressors, medication side effects, and lifestyle impacting medication adherence for each individual person. This ultimately allows prescribers to predict which treatment and prevention strategy may produce the best outcome in a specific patient and is in contrast to that one size fits all approach that we've seen in the past.
So here's some insight into how a typical visit between the patient, the PA students, and the PA provider looked on our clinic days. So the students scheduled a time to go in with PA Shadia, the PA we worked with at the site. We went in groups of 2 for a total of 4 sessions. Each individual group consisted of at least one Spanish-speaking student. Prior to seeing the patients, the students used the medication list from the EMR that was provided by PA Shadia to review which medications the patients were or were not currently supposed to be taking, along with the indications. After the patient was placed in the patient room, the students entered, we introduced ourselves, explained the purpose of the intervention, and obtained consent. If consented, then the pre-survey was verbally conducted in the patient's preferred language, while the other student recorded the answers. Med reconciliation was then performed, and any notes that the patient had for medication were recorded. Any discrepancies were written down by the students and communicated to PA Shadia in her office, which was outside of the patient room. And then PA Shadia went in the room to conduct the patient visit on her own. From the result of the pre-survey and discussion with the patient regarding the best modality to help learn about their medications, the students created a medication passport that was tailored to the patient's preferences. Once PA Shadia concluded the visit and communicated any changes to the patient's medications, the students then re-entered the room and delivered the medication passport. A thorough explanation and room for questions were given at that time, and then a post-survey was verbally given to the patient in their language of choice by one student and recorded by the other.
So for this slide, we decided to show you all examples of different types of medication passports that the patients chose and mentioned that this modality, whether it was digital, written, or audio forms, would help them know what they're taking and how to correctly take it. So for patient A, they wanted a digitized version of their medications that they could have in their notes section of their phones and carry with them at all times. For patient B, they wanted it on paper, written out in their chosen language so they can put the document on their refrigerator at home as a reminder. And then for patient C, in addition to a written paper version, they also wanted a recorded/audio version because they struggled with their eyesight. So they wanted the audio version to listen to, or in case they wanted to send it to a family member that is helping them with their medications as well. I will also be talking about health literacy, cultural humility, and trauma-informed practices. So for health literacy, as we know, it is a crucial skill needed by patients to help maintain adherence to treatment and mitigate poor health outcomes. Therefore, in order to help overcome the health literacy gap in certain populations, we made sure that all communication would be conducted with language below 5th to 6th grade reading level, as recommended by our research. In addition, we also made sure to include as part of our intervention the learning modality that the patient preferred, just in case reading or writing was something that the patient struggled with. Therefore, we offered audio and video recordings as well. Also, by conducting the encounters in teams of 2 and always having a student that felt comfortable speaking Spanish, it really helped to effectively communicate with patients and bridge that health literacy gap. Next, for culture humility, it's a big part of our intervention at Clínica Romero due to the majority of the patient population being from the Latina community. Values such as respect for the elder, family-centered care, and using the usted form were utilized in order to show respect, appreciation, and to build rapport. In addition, we also made sure to implement trauma-informed practices by always asking permission, confirming their level of comfort, asking how they would like to be addressed, and sitting at eye level with the patient to indicate a mutual level of respect. To ensure that there was equity and inclusion among our patients, when asking PA Shadia to help us with this project, we did not specify any race, gender, or age parameters to ensure that all patients were welcome to participate if they chose to do so. Additionally, for equity purposes, we also offered assistance in reading the pre and post surveys for them during the encounter if needed. And lastly, we were able to demonstrate advocacy for the clinic patients during the encounter by always encouraging them to ask us questions or concerns, ensuring them that this was a time and a safe space to ask any question that came to mind. We also made sure that they knew they had a voice and encouraged them to advocate for themselves and voice concerns at subsequent visits, and to always request a translator or interpreter if needed, because it's the law that any clinic or hospital they go to provide them with one if requested.
Hello, everyone. I'll be talking about the project goals and objectives. Our goal for the project is to increase patient medication adherence and understanding of medication regimen through a personalized medication passport. We really wanted to focus on patients with multiple medications. We found out that we probably could make the most impact through them. And then our objectives to reach for our project was patients returning to Clinica Romero with multiple medications will demonstrate the capability to provide an accurate medication list during follow-ups. Upon the conclusion of the intervention, patients will display a proficiency to recognize the purpose of the medication. So pretty much when they're done with their follow-up visit with the medication reconciliation, they'll verbalize their understanding, so that when they leave, they'll know what they're doing until their next follow-up. Providers will be able to note enhanced communication between themselves and the patients regarding medication management. And then lastly, patients will exhibit understanding of the regimen through verbal expression, as I mentioned earlier.
Thank you, Harry. So these next few slides will now be about the actual results we got from our intervention, as well as the impact our intervention had on this patient population. So first, we did end up with 8 patients who filled out the pre-surveys and post-surveys. These patients were chosen by PA Shadia for us to see while each of us visited Clínica Romero. In our analysis, we also saw that there was a 60% increase in the number of medications that the patients had before and after the visit. Some of this increase was due to actually having 2 patients who were not on any medications to start with, but who were then put on 3 or more medications by the end of the visit. 17% increase of patients who were comfortable with taking their medications. And we will discuss more about this in the next slide. And then we also noticed no change in those who understood how to take their meds. And while there was no change in our data with the surveys, we feel that in our conversations with the patients, there seemed to be a definite change. For instance, we saw that while many of them stated they understood how to take their medications in the pre-survey, many of them actually did not have the correct information when asked further why they took certain medications and how exactly they were taking it. While it is hard to quantify this anecdotal information in the surveys, it was something that we felt was important in showing the value of our intervention. And then the next statistic was that 40%, there was a 40% increase in those taking their meds. And again, I'll expand on this on the next slide. And here on the sides, right here are just pictures of our pre and post surveys that we use. So in regards to our impact, like I mentioned last, there was a 40% increase in those taking their medications. One patient in particular noted on his pre-survey that he was not taking his medication because of fear of side effects. However, in his post-survey, we saw that he had an increased understanding of his medications, as he had noted that he would start taking his medication after we performed our intervention by explaining each and every medication, and then writing all the information on a piece of paper for his intervention choice, as his intervention choice. As I said earlier, 17% increase in those who felt comfortable with taking their medications. And there's an example of this statistic was when we saw in the pre-survey that one patient noted that she felt uncomfortable reading her medications, but later in the post-survey, she felt very comfortable reading her medication. And this was because the intervention that we did for her was that we wrote down all her medications on a piece of paper in her preferred language of Spanish. And we also took a picture of that on her phone so that she also has access if she ever lost that paper. Additionally, we provided education for newly diagnosed patients with diabetes. As I said earlier, there was a patient who started off with 0 medication, but by the end of the visit, he actually had 6 new different diabetes medications, including metformin, which we actually taught him how to titrate up from 500 milligrams daily to 1,000 twice a day. And we ensured that he understood this by implementing the teach back method. We then taught patients how to utilize various apps on their phones to easily access medication lists. With one of our team members who saw the patient's eagerness to learn about the Notes app on the iPhone. So once we showed them that we could input all their medications there for easy accessibility, they were very pleased with that intervention and the ease that they were able to access that. And that was also done in their preferred language of Spanish. And lastly, not only did we list the medication names, but we also put how and when to take it in the preferred language again. While our project ends now, we hope that our efforts and this intervention will have a long-term impact on these patients' health.
We did encounter some obstacles or barriers throughout the project. Some to note is that with our passport, it wasn't really a one-size-fits-all kind of passport, but that was a pretty easy solution. With technology and everything progressing nowadays, we were able to create personalized plans for everybody. There was another barrier with the language barrier. Not all of us spoke Spanish, but we figured that out by just pairing up the primary Spanish speakers with a non-primary Spanish speaker. And together we were able to work out all the translations together. And then PA Shadia's schedule didn't always align with ours. We were only really given Monday and Tuesday because we were working in our respective clinics Wednesday, Thursday, Friday. So we worked that out by going multiple times, fitting in with PA Shadia's schedule. And lastly, post-analysis discrepancies that may have the data skewed. For example, it showed that in our pre and post surveys that many of the patients understood what they were taking at the time of the pre-survey, but after, in actuality, and speaking it and going over with the patient, it was not always the case. So a solution we will propose is that we can first inquire about the patient's medication prior to having them fill out the survey so that the patient and us can see their true comfort levels.
All right, we're going to wrap up our presentation with something called Star Star Wish. So this is 2 things that we were really excited about as a group, and a wish, kind of an improvement or a future forward thinking thought. So our first star was that patients appreciated that the product we created with them was customized specifically for them to help with medication management. The individualized approach really seemed to empower patients to be active in their care, regardless of what language or health literacy barriers they might face. Another thing that we put as a star was that patients seemed to appreciate that us as the student provider was able to take extra time that's not usually found during these visits to be able to explain what the medications were for and how to take them. This really encouraged patients to adhere to medication regimens by providing them with the reason as to why they're taking certain medications that they might have been less certain about in the past. A wish that we have moving forward is that the implementation of this customized medication passport will make reconciliations a smoother process for providers and will continue to empower these patients that we worked with to take an active role in their health. For future students that visit we decided to generate a recommendation. We would encourage all future students to continue to integrate the personalized medication passport for each new patient in association with the clinic team. Not only does the passport provide the opportunity for the students to practice medication reconciliation, but it also gives really strong insight into the barriers that might exist for those patients. Additionally, for our peers that will be watching this, are about to graduate in 1 month, we urge you when you enter clinical practice to remember that the patient education can look different for everyone, and spending time developing a system upfront will most certainly save time in the long run. It's also a reminder that your support staff, whether that's nurses or MAs, are really optimal to the integration of the team-based practice. All right, and finally, a huge thank you to our community partner with whom the project would not have been possible, Clínica Romero. Thank you so much for encouraging us to learn and to further the health of our community in whatever way we can. To our audience, thank you for watching our presentation, and we welcome any feedback, questions, comments, or suggestions you may have regarding our project.